10 warning signs of stroke you could notice a week in advance. Your brain is constantly sending you warning signals, and when it comes to stroke, these signals can appear up to 1 week before the actual event occurs. Most people miss these crucial early warning signs, dismissing them as stress, fatigue, or minor ailments. Understanding these pre-stroke indicators could literally save your life or the life of someone you love. Stroke affects approximately 795,000 Americans each year according to the American Heart Association, making it the 5th leading cause of death and a leading cause of long-term disability. What many people don't realize is that the majority of strokes don't happen suddenly without warning. Research published in the New England Journal of Medicine shows that nearly 80% of strokes are preceded by detectable symptoms in the days and weeks leading up to the event. Today, we'll explore 10 critical warning signs that your brain may be crying out for help 1 week before a stroke occurs. These aren't the typical fast symptoms you've heard about. Those occur during the stroke itself. These are the subtle, often overlooked signals that appear in the crucial window when intervention could prevent a devastating stroke from happening. By the end of this video, you'll be equipped with life-saving knowledge that could help you recognize these early warning signs in yourself or others. Remember, time is brain tissue. Every minute matters when it comes to stroke prevention and treatment. Disclaimer: this video is for educational purposes only and should not be taken as medical advice. Always consult a licensed healthcare professional for any questions or concerns about your health, medical conditions, or treatment options. All information presented has been thoroughly researched and verified. You can find source links in the video description. 1. Sensory alterations, tingling. Sensory alterations, particularly tingling or pins and needles sensations occurring 1 week before stroke, represent subtle neurological warning signs that indicate compromised blood flow to the brain's sensory processing centers. This phenomenon, medically termed paresthesia, typically affects one side of the body and differs significantly from the temporary tingling you might experience when a limb falls asleep from pressure on peripheral nerves. Stroke-related tingling originates from the brain's somatosensory cortex and follows specific neurological patterns. The primary somatosensory cortex, located in the parietal lobe just behind the central sulcus, processes all conscious sensory information from the body's surface. Research published in Neurology demonstrates that sensory symptoms, including paresthesia, precede stroke in approximately 15% of patients, particularly those who later experience strokes affecting the parietal lobe or thalamus. The middle cerebral artery supplies the lateral aspects of the somatosensory cortex, while the anterior cerebral artery supplies the medial portions, making both vulnerable to vascular compromise. Stroke-related tingling usually affects an entire side of the body, face, arm, and leg together, in a neurological pattern, unlike peripheral nerve problems that follow specific nerve territories. It results from reduced blood flow to sensory brain areas, causing abnormal nerve firing and the characteristic prickling or burning sensations. The thalamus, which serves as a relay station for sensory information traveling from the body to the cortex, is particularly vulnerable to small vessel disease and can produce diffuse sensory symptoms when its blood supply becomes compromised. These sensory alterations often occur in episodes, lasting minutes to hours, and may be accompanied by subtle weakness or coordination problems as adjacent motor areas also become affected by the same vascular compromise. 2. Dizziness or vertigo. Recurrent, unexplained dizziness or spinning sensations appearing days to weeks before a stroke often indicate problems in the posterior circulation of your brain. This involves the vertebrobasilar system, the network of arteries that supply blood to the brainstem, cerebellum, and back portions of your brain. Research published in PMC, PubMed Central, studying basilar artery strokes found that vertigo was the most common prodromal symptom, occurring in approximately 44% of cases. The basilar artery is a major vessel formed by the joining of the two vertebral arteries, supplying crucial areas of your brainstem. This dizziness reflects transient ischemia in the brainstem or cerebellum. Ischemia means reduced blood flow, and when it affects these balance control centers, you experience spinning sensations, unsteadiness, or feeling like the room is moving around you. These episodes often result from large artery atherosclerosis affecting the vertebrobasilar vessels. Atherosclerosis is the buildup of fatty deposits in artery walls, narrowing the vessels and reducing blood flow. Patients frequently experience accompanying nausea and vomiting due to vestibular dysfunction, problems with the inner ear balance system connected to these brain regions. The pattern is typically described as stuttering onset, where symptoms build gradually rather than appearing suddenly. This occurs more often in older men with hypertension and large vessel disease, correlating directly with these prodromal balance symptoms that serve as early warnings of impending stroke. 3. Sudden hearing loss. Abrupt sensorineural hearing loss represents a rare but significant prodrome of vertebrobasilar stroke. This type of hearing loss affects the inner ear or the nerve pathways from the inner ear to the brain, different from conductive hearing loss caused by ear canal or middle ear problems. Recent case series published in PMC identify sudden bilateral or unilateral hearing loss as a warning sign of impending AICA infarction. AICA stands for anterior inferior cerebellar artery, a vessel that supplies both part of the cerebellum and the inner ear structures. Research shows that patients with vascular risk factors, typically aged 40 to 55 with 3 or more stroke risk factors, who experience profound acute hearing loss have significantly higher stroke risk. This connection exists because the AICA supplies the cochlea and vestibular organs in your inner ear. The mechanism involves transient occlusion of the AICA, which can cause sudden deafness as blood flow to inner ear structures becomes compromised. When this same artery becomes completely blocked, it results in cerebellar stroke affecting balance, coordination, and hearing simultaneously. This warning sign is uncommon but clinically significant because it represents a very specific vascular territory. Any otherwise unexplained sudden hearing loss, especially when accompanied by vertigo or balance problems, should prompt immediate stroke evaluation. The key is recognizing that sudden hearing loss without obvious cause, no ear infection, trauma, or exposure to loud noise, could indicate vascular compromise in the posterior circulation. Time is critical, as identifying and treating the underlying vascular problem could prevent a devastating stroke. 4. Visual disturbances, transient vision loss, or diplopia. Episodes of blurred vision, double vision, or temporary vision loss can serve as critical warning signs appearing up to a week before stroke. These visual symptoms reflect transient ischemia affecting various parts of your visual system. Amaurosis fugax represents one of the most significant warning signs, transient monocular blindness affecting one eye. This classic symptom indicates ipsilateral carotid artery disease, meaning problems with the carotid artery on the same side as the affected eye. It occurs when an embolus travels to the retinal artery, temporarily cutting off blood supply to your retina. Studies documenting posterior strokes, published in PMC, specifically note prodromal diplopia and vision impairment. Diplopia means double vision, where you see two images of a single object because your eye muscles aren't coordinating properly due to interrupted nerve signals. Research on basilar stroke specifically mentions double vision and vision loss as early warning symptoms. These reflect transient ischemia of visual pathways or dysfunction of ocular motor nerves, the nerves controlling eye movement and coordination. These visual episodes occur more frequently in older patients with carotid or vertebrobasilar atherosclerosis. The carotid system supplies the front of your brain, including visual processing areas, while the vertebrobasilar system supplies brainstem centers controlling eye movement. Repeated transient vision episodes should prompt urgent carotid and vertebral imaging. Don't ignore brief episodes of vision loss or double vision, especially if they resolve quickly. They may be your brain's way of signaling impending danger. 5. Nausea and vomiting. Unexplained episodes of nausea or vomiting, particularly when accompanied by dizziness, can signal vertebrobasilar insufficiency, inadequate blood flow in the arteries supplying the back of your brain and brainstem. Research on basilar artery stroke cohorts, published in PMC, found that 25% of patients reported recurrent vomiting episodes in the week before their stroke. This isn't the typical stomach flu or food poisoning nausea. It's neurological in origin. The physiological mechanism involves transient posterior fossa ischemia, The posterior fossa is the back part of your skull containing the brainstem and cerebellum. When blood flow decreases in this region, it affects the vestibular nuclei, brain centers controlling balance and spatial orientation, or the cerebellum itself. These symptoms often co-occur with vertigo and imbalance because they share the same blood supply and neurological pathways. The brain regions responsible for balance, coordination, and nausea control are intimately connected and supplied by the same arterial system. This warning pattern is more common in posterior circulation strokes, such as basilar thrombosis, where a blood clot forms in or travels to the basilar artery. It's also seen in patients with risk factors like atherosclerosis or arterial dissection, a tear in the artery wall that can block blood flow. Any sudden onset of nausea without clear gastrointestinal cause in someone with vascular risk factors warrants immediate evaluation. Don't dismiss persistent nausea as a simple stomach bug if you have stroke risk factors. 6. Seizures. New onset seizures, particularly focal seizures with or without generalization, may occasionally herald an impending stroke. Focal seizures begin in one area of the brain, while generalized seizures involve both brain hemispheres from the start. Seizures in the stroke prodrome reflect cortical irritation caused by ischemia, reduced blood flow causing brain tissue to become electrically unstable. The cortex is the outer layer of the brain responsible for higher functions like movement, sensation, and cognition. While seizures aren't common in all stroke types, they appear more frequently in cortical infarcts, particularly middle cerebral artery strokes, and embolic strokes in elderly patients. The middle cerebral artery supplies large portions of the brain's cortical surface. Stroke prevention guidelines published by the National Stroke Association list seizures among warning signs to watch for. Research specifically notes fainting or seizure as stroke warning symptoms that shouldn't be ignored. The mechanism involves ischemic brain tissue becoming electrically irritable before complete infarction occurs. Think of it as the brain's electrical system short-circuiting due to inadequate oxygen and nutrients from reduced blood flow. Any new seizure in a middle-aged or older person with vascular risk factors should prompt immediate brain imaging to exclude ischemia. This is especially true for focal seizures affecting one side of the body or face, which could indicate problems in specific arterial territories. The key point is new onset. Seizures that begin for the first time in older adults are concerning and require investigation, particularly when other stroke risk factors are present. 7. Transient ischemic attacks, TIs. Transient ischemic attacks, commonly known as TIs or mini-strokes, represent perhaps the most critical warning sign that a major stroke may occur within the following week. A TI occurs when blood flow to a part of the brain is temporarily interrupted, typically lasting anywhere from a few minutes to less than 24 hours. The word transient means temporary. Ischemic refers to reduced blood supply, and attack indicates the sudden onset of symptoms. According to research published in the Lancet Neurology, approximately 43% of major strokes are preceded by TIAs within the previous 7 days. This statistic underscores the urgent nature of these warning events. The temporary nature of TIAs occurs because the blood clot or obstruction either dissolves naturally or is dislodged, allowing blood flow to resume before permanent brain damage occurs. However, this restoration of blood flow is often temporary, and without proper medical intervention, a more severe and lasting stroke frequently follows. The symptoms of a transient ischemic attack, TI, closely resemble those of a stroke but resolve within 24 hours. They may include sudden weakness or numbness on one side of the body, difficulty speaking or understanding language, vision changes, dizziness, or a severe headache. The crucial difference is that these symptoms disappear completely, which often causes patients to underestimate the seriousness of the event. However, ignoring a TIA can be dangerous, as it is a medical emergency that requires prompt evaluation and treatment. A transient ischemic attack, TI, occurs when blood flow to the brain is briefly blocked by a clot or narrowed artery. Unlike a stroke, the blockage clears on its own, but it signals high risk. Without treatment, 10 to 15% of patients develop a major stroke within 90 days, most often in the first week. 8. Ataxia or coordination problems. Subacute onset of clumsiness, incoordination, or gait imbalance may precede strokes in cerebellar or brainstem territories. Ataxia refers to lack of muscle coordination, making movements jerky, unsteady, or imprecise. The same posterior circulation ischemia, causing vertigo, can manifest as limb ataxia because the cerebellum and brainstem work together to coordinate movement. The cerebellum fine-tunes motor movements, while brainstem centers integrate balance and coordination signals. Research published in PMC noted prodromal ataxia, along with other warning symptoms in posterior circulation strokes. These coordination problems reflect reduced blood flow to brain regions critical for smooth, coordinated movement. Patients may report frequent stumbling, inability to perform finger-to-nose testing smoothly, or dysarthria, slurred or difficult speech due to poor coordination of speaking muscles. These symptoms indicate problems in cerebellar or brainstem function. These coordination prodromes are more common with vertebrobasilar atherosclerosis affecting the arteries supplying the cerebellum and brainstem. The vertebral arteries join to form the basilar artery, which gives off branches supplying these coordination centers. Older patients with known vertebral artery disease, especially following neck pain or trauma that could cause arterial dissection, may present with worsening ataxia before experiencing a full stroke. The key is recognizing new or worsening coordination problems, especially when they develop gradually over days to weeks. This isn't the sudden loss of coordination seen during an acute stroke, but rather a progressive warning sign. 9. Speech difficulties. Speech difficulties appearing 1 week before stroke represent critical warning signs indicating compromise of the brain's language centers, primarily located in the left hemisphere's frontal and temporal regions. These speech problems, medically termed dysarthria or aphasia when transient, manifest as slurred speech, slow or hesitant speaking, word-finding difficulties, or speech that sounds garbled or incoherent. Unlike permanent speech problems that occur during an actual stroke, these pre-stroke episodes are temporary but serve as urgent warnings of impending neurological catastrophe. Broca's area in the frontal lobe controls speech production, while Wernicke's area in the temporal lobe governs comprehension. Because both rely on the middle cerebral artery, reduced blood flow here can cause transient speech problems that may precede stroke in nearly 1 in 5 patients. Dysarthria results from impaired motor control of speech muscles due to reduced blood flow to the brainstem, cerebellum, or motor cortex, leading to slurred or slow, labored speech. Expressive aphasia involves difficulty finding words or forming sentences, while receptive aphasia affects understanding complex language. These brief, recurring speech disruptions often signal imminent stroke risk. 10. Mood or behavioral changes. Unexplained mood or behavior changes can appear up to a week before a stroke, but are often mistaken for stress or aging. Signs include sudden irritability, anxiety without cause, mood swings, or personality shifts. These changes stem from disrupted limbic system and prefrontal cortex function, often due to reduced blood flow in the anterior or middle cerebral arteries. Research shows about 23% of patients, especially with right hemisphere or limbic strokes, experience such symptoms beforehand. Sudden onset anxiety may appear as panic, restlessness, or a sense of impending doom, often from disrupted blood flow to fear-processing regions like the amygdala. Patients may feel on edge, reflecting the brain's recognition of its own dysfunction. Irritability and personality changes arise from impaired flow to the orbitofrontal and anterior cingulate cortices, disrupting judgment, inhibition, and social behavior. This can cause aggression, poor decisions, or inappropriate reactions, often noticed by family. The mechanism involves disrupted serotonin and dopamine regulation from reduced oxygen and glucose, commonly seen before strokes in the anterior cerebral artery territory. Don't forget to like and subscribe. Share this information, stay vigilant for these warning signs, and remember that recognizing these early symptoms and acting quickly could save a life and prevent the devastating consequences of stroke.